I went into medicine hoping to help people, but the system got in the way, and nobody could tell me why the system was doing what it did.
Over 50,000 public health officials at the local level have lost their jobs in the last 10 years.
But when crises occur and when there's a need to collaborate, our community really comes together.
One reason to be optimistic is in the animal models, it looks like you do get a preventive type of antibody response.
When I think about it from my vantage point, I think about the digital divide as one of those bigger issues and one of those bigger challenges.
And I would hate to see a promising drug slow down because you can't find the people.
And so what the remote trial did was really pull together a lot of components that already existed in the world.
I view telemedicine as a liberating technology for clinicians as well as for patients.
It would change the hospital business going forward.
Usually about a quarter to a third of people who are admitted to hospitals with those conditions can be taken care of safely at home.
And the first words out of their mouth are, "I've never done this before. This is so cool."
You have to look at hospital at home and say, why isn't hospital at home 20 or 30% of hospitalization in America?
The merger of these two companies will come together in a way where we both have an interest in seeing the health of individuals improve around the world.
Providing, again, world-class coordinated longitudinal care for populations struggling with kidney disease.
And all of it without any device or wearables, it's just completely passive.
We can do value-based arrangement in a way that actually leads to a financial stability for these practices.
I think this really does give us a chance to significantly rethink how we're designing and using healthcare.
There is a wealth of data out there that exists outside of the normal clinical setting.
In order to tackle these diseases of the brain, we really needed to break down the silos of these different data types.
There's some very interesting things in machine learning that actually cut across cultures, but some of it is very cultural dependent. And the way we use language is very culturally dependent.
It is that positive perception of aging, that optimism. What are the possibilities? Why at 85 can't you have a vision for tomorrow? Why at 90 can't you think about what's important and what you want to do in life?
The science fiction part will be not how technology tears us apart, but how it brings us together, how it makes us sort of join together around that digital campfire.
We could make this promise of digital health a reality together.